Yeah. Yeah. And in Indonesia, we should have a vaccination certificate to travel from city to the city.
Yeah. Yeah, I think it's going to be the same in Australia as well. And certainly for flying internationally, we will have to have our vaccine certificate.
So you got the vaccinated?
Yep, I've had both my vaccinations. I've had 2, so that's good. All done.
Yeah, it's good. Yeah. So you can fly to Yogyakarta.
Well, I'm not quite sure about that one. No, the government's not very keen on us flying at the moment, so it's. I think it'll be a little time yet. Yeah, I would love to be able to, but I don't know that, one, they wouldn't give me permission to fly out, and I'm not sure I'd get permission to fly back again.
Yeah, it should be on July, so you can attend our Congress in Yogyakarta.
Next July next year. Oh yes, I'll be ready for that. So I'll get my dancing body on.
Yeah.
I'll make sure I've learnt some new dances for you then, Ali.
Yeah, I think you should learn traditional dancings.
Ah, yes. I don't think my body is quite mobile enough to learn your dancing. Yeah, so terrific.
So yeah, our next Congress will be combined with the International Society of Electrophysical Agent in Physiotherapy Summit.
Okay.
Maybe in Jakarta.
In Jakarta. Well, who knows? Hopefully by then. And we have the AWP meeting in Hong Kong in June.
Oh.
Yeah.
So
again, hopefully.
Hopefully.
So all you can do at the moment is say hopefully. Yeah. Yeah. So who's in the meeting today? We've got your staff.
Yeah. Also, our vice rector of the university also attend this meeting, Mr. Taufikur Rahman.
Mm-hmm.
And then,
good morning, Dr. Jill.
Good morning.
I'm Taufik.
Good.
I'm the vice rector for academic and cooperation affairs.
Very nice to
meet you.
Yeah, very nice to meet you.
Yes.
A lot of my old friends here, or not so old, but long-term friends. Ali has been looking after me for many years in Indonesia. So,
yeah,
he's been very long years. We've been together at conferences and meetings and workshops. So, yeah. That's good. And your university is going well?
Yes.
Yeah. Are the students attending, or are they at home and you're doing online learning?
Yeah, most of the students are at home, but we did some of the practical work, but with very strict health protocol in campus. Yeah. Because not all of the subject we can do it online.
Yes,
especially for the practical learning that they have to practice.
No, it's been very hard, hasn't it? So
yes,
it's done. Good. Oh, that's good. Well, I'm looking forward to this. Are you thinking of applying for accreditation?
Ya, mungkin Pak Taufik.
Yes, we're preparing several departments, including the physical therapy department, to prepare for the international accreditation.
Good.
Because some of them already had very good accreditation in national level.
Yeah.
So yeah, we move forward, and we hope we can move forward to get the international accreditation.
Yeah, no, that's good. So in Indonesia, who does the accreditation?
We have a board, yeah, international national board for national accreditation.
That's a
Yeah,
government
for
board.
all. Yes, the government
Yeah.
board for all universities in Indonesia. And for that's for university, especially for university, and for the specific department, especially for health sciences, yeah, we have they have their own board of accreditation for health sciences.
Yeah. So today I will look at with you accreditation as suggested by the World Confederation or World Physio, and also what we do in Australia and New Zealand to give you an example of the accreditation processes that we use here. Yeah.
Okay.
Good.
Yes, we look forward to it as well.
So Ali, do you want to share the screen? Do you want to get started or?
Yeah, we will start the opening of this meeting soon.
Okay.
Maybe the Budika sudah bisa mulai?
Oke, baik Pak. MC Bu Devin.
Oke, silakan
Bu
Devin.
Devin. Okay, shall we start right now? Okay, participant, the workshop is going to start in a few minutes. Please be seated. This event was broadcast live on our channel and can be streaming on the Fakultas Ilmu Kesehatan Universitas Aisyah Yogyakarta YouTube channel.
Good.
Excellencies, distinguished guests, participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you. Good afternoon to Dr. Gillian Webb, and good morning to all of you. And we are delighted to welcome you to the International Kurikulum Workshop today. To the Honorable Mr. Taufikur Rahman as a Vice Rector for Academic and Research Development, to the Honorable Mr. Muhammad Ali Imran, the Dean of Faculty Health and Science, and Excellency to our speakers and lecturers, guys, and all participants. First of all, let's say thanks to Allah Subhanahu wa Ta'ala who has gave us guidance, happiness, and health so we can attend and participate in this special event without any obstacle. Praise and salutation upon our Prophet Muhammad Sallallahu Alaihi Wasallam who had brought us to the path of light from the darkness in this life. It is precious change for me to lead on this very special occasion with the topic entitled Workshop on the International Curriculum Accreditation in General, Academically and Clinical Learning Practice based on World Physioterapi Guidelines. First of all, the agenda of today's workshop as follows. First, welcome remark from Mr. Ali Imran, and then opening speech from Mr. Taufik, and the third, workshop materials and discussion from Professor Webb, and the last is closing. Well, ladies and gentlemen, let's begin this event by reciting Basmalah. The next agenda is welcome remarks. Without further ado, I invite the Dean of Faculty Health and Science, Mr. Ali Imran, to give his remarks. Please welcome Mr. Ali Imran.
Okay, thank you, Devin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning and good afternoon, Bapak Ibu yang saya hormati, yang terhormat Bapak Taufikur Rahman, Bapak Wakil Rektor 1 Bidang Akademik dan Research, kemudian yang saya hormati Bapak Ibu sekalian, Kaprodi di lingkungan Fakultas Ilmu Kesehatan, dan tentu saja our distinguished speaker, Professor Dr. Gillian Webb. Thank you very much for coming to this event. Actually, we already have a curriculum review every 4 years. So for the physical therapy department, today is the second review for the curriculum. But in this meeting today, I think it's very special because this review curriculum is integrated with the program from the Minister of Higher Education and the finding also by Minister of Higher Education. So not only for the curriculum review, but also we particularly in Faculty of Health Science, we are also improving our laboratorium equipment, module, and also the to adapt it with new technology, especially in visual technology as a tool learning the student. Bapak Ibu yang saya hormati, hari ini tentu saja kita sangat berbahagia karena dimulai dari program studi fisioterapi kita melakukan review kurikulum, meskipun juga di prodi-prodi lain ya, prodi keperawatan juga sudah jalan, prodi kebidanan, dan prodi-prodi yang lain segera menyusul. Tetapi untuk fisioterapi kita bersyukur karena ada tambahan event yang bisa mendatangkan speaker-speaker dari internasional. Mudah-mudahan kita bisa belajar bersama dari sini, dari workshop pagi hari ini, dan terima kasih atas kehadirannya. Saya mohon kepada Bapak Wakil Rektor 1 untuk bisa memberikan arahan serta petunjuk agar betul-betul review kurikulum khususnya fisioterapi ini bisa berjalan dengan baik, bisa mendapatkan manfaat yang luar biasa karena memang fisioterapi sedang pada siklus yang agak menurun. Mudah-mudahan ini menjadi milestone pijakan baru untuk teman-teman fisioterapi bisa mengembangkan diri ke depan. And again, for Dr. Gillian, I would like to express my big thanks for your time and your experience and your knowledge to share with us today. And actually, we are in Indonesia miss you very much because maybe 2 years you not coming to Indonesia. So I hope in the future we can meet again in Indonesia and also in our campus in Yogyakarta. Then I would like to thanks also to all participants, and I hope you can enjoy this meeting and we get the beneficial for our faculty. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Mr. Ali Imran for the remarks. Move on to the next agenda is an opening speech from Mr. Taufik. Please welcome Mr. Taufik. Time is yours.
Okay, thank you, Divin. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone.
Good morning.
It's really a great opportunity to start our workshop today. And first of all, I would like to thanks to our honorable speaker, Prof. Gillian Webb, and also the Dean of the Faculty of Health Sciences, Universitas Aisyah Yogyakarta, Pak Ali Imran, the head of the Department of Physical Therapy, Ibu Dika, and all the participants of this workshop. Very good morning for all of you. And on behalf of the rector of the university, I would like to thanks to Prof. Gillian for your time today with us to discuss how to prepare for international accreditation. So I would like to welcome you to our university virtually.
Thank you.
Unfortunately, this is a virtual welcome ceremony, and hopefully next time, you will be able to visit our university physically. Okay. And just a little bit about our university. Our university has a very strong focus on health. So our physical therapy department is also one among the small number of physical therapy higher education in Indonesia. So I think this is a very good chance, for the Department of Physical Therapy in our university to always improve the quality. So hopefully the department will become the excellence, the center of excellence of physical therapy education in Indonesia. So we do really hope by the assistance of Professor Gillian, our dream will come true. And as I mentioned before, that most of our department in the university already achieve at least very high, very good accreditation from our National Board of Accreditation. And we are moving forward for several departments to develop the curriculum. And we try to integrate the curriculum with international standards. So when we ready to apply for the international accreditation, so we don't need to prepare any longer, because we already integrate our curriculum with international standards. So that's also part of the aim of our workshop today. We need to have perspective on how the international accreditation, especially using the standard from WCPT, that already established in Australia, for instance, that we can learn to practice it in our university. And for the Department of Physical Therapy, the committee, so we again, on behalf of the rector, we appreciate this event, and hopefully this is a starting point for us to develop our curriculum by integrating the curriculum with international standard. Okay, thank you very much. I think that's all for my opening speech. And thanks also to all of the participants, and hope we have a very good and opportunity today to learn from Prof. Gillian. And I will finish my opening speech. Stay safe, stay healthy for everyone. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
We are pleased to hear the opening speech from Mr. Taufik. Thank you so much, Mr. Taufik. Moving on is the main agenda that we have been waiting for. We are fortunate to have professional speakers today. She has been involved in physiotherapy education for many years. Along with her college, she established the School of Physiotherapy program at the University of Melbourne. She was deputy chair of the WCPT AWP region in 2007 until 2011, and now sits on the executive committee of the WP and AWP region. She holds honorary position with a number of universities in countries in Asia and the Pacific. She is involved and active in developing physiotherapy and other health profession education programs in Asia West Pacific region. not to mention in Indonesia too, she's been active developing physical therapy education in Indonesia. Her research and teaching interests are in health professional education and global health, has been the keynote speaker at numerous conferences, and has run workshops in a variety different countries. So we are honored to welcome our today's guest, none other than Professor Gillian Ruth-Webb. Good afternoon, Prof.
Thank you very much. So it's an absolute delight for me to be here today. As I said a bit earlier, Indonesia has been a very special place for me, and I've been very fortunate to be, I think, going and attending to conferences and workshops in Indonesia for perhaps the last 20 or so years. So I feel very much part of the physiotherapy profession in Indonesia. Your dean has been a particularly significant friend to me and colleague, and I value that friendship and collegiality. I was lucky to come down for a short visit to Yogyakarta last time I was in Indonesia, to your school there, and I look forward to coming there again in the future. So it's very sad that we can't meet together, but it is good at least that we can do things on a virtual basis. So I look forward to this session and hope that I can contribute to your moving forward around accreditation. It's a very important area around providing excellence for our practice. So I look forward to the session this morning. So thank you very much for inviting me again. And as I say, I hope we can have a good discussion about accreditation. Yep.
We're pleased to hear that. Okay, Prof, before you start, I would like to explain the sequences of this workshop. It will be divided into sharing your materials and then and experiences, of course. And after that, there will be a discussion. So maybe you can start right now, Professor Webb.
Share the screen.
Yeah, you can start share screen right now.
I just got to find the, there we go. Can you see that? Now, if I put it on the full screen is what it needs, isn't it?
It's already shared to us, but not in a full screen.
There. Is that it?
Yes. Okay, Prof.
Good.
Yes, it's already.
Okay, so thank you again for inviting me today to talk with you here. We know that to have excellence in physiotherapy practice, it revolves around these four issues. We need excellence in education, and that's something that you've been developing in Indonesia over the last few years, which is really great. Research, and again, with your people in Indonesia beginning to go to master's levels and PhDs, the research output from Indonesia too will increase. And then we have regulation, so this is the government thing, we'll talk a little bit about that, and accreditation of the programs. So this is, if you like, the quality assurance to make sure we continue to have excellence in physiotherapy practice. So if we look just briefly at regulation first, because it is the regulation that drives the accreditation, if you like. And regulation, and I know you are now regulated in Indonesia, thanks to the work of the Physio Association, particularly from your dean, who did a lot of work around regulating physiotherapy practice in Indonesia. And it's there to protect the public. It's there to say that if you call yourself a physiotherapist, you will provide safe and good practice. So protecting the public by making sure they're qualified physio. So people in the community can't call themselves a physiotherapist because by law, the name is protected by law. The regulatory board too should set the standards of continued practice competencies, and we'll look at those in a minute. And that's important so that they know that people have achieved the right competencies and processes to be called a physiotherapy. Set a monitor standards of professional ethics and conduct. Again, so this is the protection of the public, how we behave, how we act as professional health providers, and how people can, the public or students or colleagues can say to a regulatory authority that people are doing things that are not right. Maintaining a register of the licensed physios. What happens when someone doesn't comply, doesn't behave properly? How does that happen? Looking at the regulatory board would look at new advanced scopes of practice. So something like injecting regimes. In Australia, we're not allowed to inject as a physiotherapist. And so there's papers have been developed recently where there should be some cases where physios should be allowed to inject, particularly in the sports area. And also the regulatory board would be responsible for looking at modifying education practice and what happens, particularly over the last 18 months, what's happened with the pandemic and how that has affected education, and therefore how those graduates will be allowed to practice as physiotherapists. So World Physiotherapy, or which was the World Confederation of Physiotherapy, in their regulation that's just come out again, states it reduces the risks posed by health professionals to physically or psychologically do harm to the patients. And it must focus on the public and not on the interests of the individual physiotherapist or the physiotherapy profession. And the regulatory system really should provide to the public trust and confidence in the profession about the competencies of physiotherapists to work in the health area. So it's a really important thing, regulation, and there it's through the regulation that we move into things like education and accreditation, because it's the regulatory body that should hold the overarching responsibility for physiotherapy and it's the way it is conducted. So the World Confederation, through systems, the protection, we've said that. So they commented that there are 4 key elements in regulation. One is that the education programs have met the professional entry requirements, and that's what we're going to talk about with accreditation. But there also regulation is there to make sure that you and I, as practicing physiotherapists, we maintain our levels of competency and standards as well. So it's not just for the new graduates. And as I said, there are the professional ethics and conduct and keeping a register. So in Australia, the standards set by the regulatory board set out the minimum requirements to deliver programs. So that's the accreditation, and that's caused by the Physiotherapy Board of Australia. So we have a regulatory authority that's called the Australian Health Professional Regulatory Authority. And underneath that sits the Physiotherapy Board of Australia. And it's the Physiotherapy Board of Australia that provides the information that we require for accreditation and for regulation of the profession. So a number of years ago now, Australia and New Zealand got together and they developed the Australian and New Zealand thresholds of practice. And I'll talk about these because it really defines the competencies expected of physiotherapists in Australia and in New Zealand. And it's not just for entry-level practitioners, it's also for you and I as we go forward as a physiotherapist. So if you look at this diagram here, in the pink, this is the undergraduate education, if you like. To get to be able to practice as a physiotherapist, they've got to meet this green line. And then once they're registered and they're practicing, we all have to make sure, from here up, we all have to make sure that we continue our professional development. So these thresholds are saying whether you're a new graduate or whether you are a graduate physiotherapist working, this is the minimum level that you can drop down to, if you like. So it's the level that the graduates come out at, but it's also a level that we don't want the graduates to go below. And so that's the importance of lifelong learning and continuing professional development. So that's a really important aspect for us as physiotherapists. And it was developed, and I'll give you a web link at the end, because the boards of Australia and New Zealand are very happy for countries in the region to use these threshold statements and adapt them to what they might need in their countries. So, as I said, these are the essential components needed for initial registration: behaving professionally and ethically, considering each client or patient as a whole. And you can see we have some Maori language in there as well, because this is a New Zealand board statement as well as an Australian one. Obtain informed consent and managing risk. So these are some of the behaviours that we expect from the threshold statements. Using evidence-based practice to support clinical decision-making, and integrate our knowledge both of the biomedical sciences and of the physiotherapy sciences and of the psychological sciences to be able to act competently as a physiotherapist. So the World Physiotherapy, or WCPT, have put out the competencies that they expect. And again, I'll give you a web address at the end, because World Physio just yesterday put out their latest edition of education policy. And it's a terrific document. And if you're reviewing your curriculum, it's really a valuable document for you to have. And I'll give you the website at the end, although you can just go into World Physio. So they look at the competencies and say physio assessment and intervention, ethical and professional practice, communication, evidence-based practice, interprofessional learning, reflective practice and lifelong learning, quality improvement, and leadership and management. So these are the competencies we expect our graduates to come out with, and for us all to be able to continue practicing these competencies. If I look at the Australian ones, they're very similar. And a lot of the work that World Physio did took into account what's been done in the UK, the US, Canada, Australia, Colombia, some different countries. So the competencies are similar competencies set out by Australia is physiotherapy practitioner. So that's similar to the first one of World Physio, where you plan and implement an effective intervention with a patient, involving the clients, reviewing their progress, and advocating for their clients and their rights to healthcare, a really important part of a physiotherapy practitioner's role. The next one is, as was in the World Physio, professional and ethical practitioner. So comply with legal, professional, ethical, and other standards. make and act informed and appropriate decisions, again, that are ethical and take in people's culture, their gender, their age, all those different aspects. And also recognize the need to manage our own physical and mental health and resilience. Really important that as practitioners, we look after ourselves as well. Because if we don't look after ourselves, it's very hard for us to be able to be engaged in the healthcare in the community. So really important looking after our own well-being. Communicator, and again, that was one that World Physio has as well. So using appropriate communication so that we develop trust and rapport, that we record, and we record legally and effectively what we're doing, and we communicate those as outcomes and decisions. And we deal with any conflict that might occur. It might be with colleagues, it might be with other health professionals, and it might be with patients or communities. So using communication is a really strong point, and I think it's one of our very strong points as physiotherapists. Being reflective practitioners and self-directed learners. So teaching our graduates and making sure during professional development, continuing lifelong learning, that we assess our practice against the benchmarks and change practice as we get new evidence for practice. Evaluate what we're not very good at and what we're really good at, so that we can perhaps engage in the learning that's needed for that. Be able to read and interpret research, really important for us to be able to look at the latest research, look to see what's good research and what's not good research. And we know, and I'm sure it's the same in Indonesia at the moment, everybody goes to the social media. Unfortunately, the social media is often not a great place to go to, because it is not necessarily based on research and evidence, but on people's own thoughts. So we need to be able to make sure we use the proper evidence. We need to apply quality improvement and risk management to our practice. So always looking, reflecting, are we doing things that are safe and effective? And recognizing that there is other people as well where we can look for with their expertise. Being a collaborative practitioner. So in the World Physio, they talk about interprofessional, and our ones here in Australia talk about collaborative. So make sure that we work collaboratively with a patient-centered or client-centered practice, but also make sure that we work really well in teams with our professional colleagues. And that's a really important issue for us to make sure we do. Be an educator. Use education to empower yourself and others. So today here we're doing a workshop, and that's terrific. So this is about education. Seek opportunities that lead the education of others. So if you're working in a clinic, helping supervise undergraduate students, but also new physiotherapists as they learn and go along their journey. And be a manager and a leader. So leading others effectively, a really important issue around leadership. And you have had some fantastic leaders in Indonesia over the number of years. Really important that we teach our undergraduate students about leadership, that they will become leaders, and how leadership works to be an ethical and valued position. And look in, as a manager, how we manage our workloads, how we're efficient, how we use money efficiently. So if you're working particularly in the public sector, how do you make sure that you use the resources available in a very financially safe and effective and efficient way. So let's move on now. So that was really looking at the role of regulation and the standard settings in regulation. And that leads down then into accreditation. Accreditation in Australia is under the role of the regulator. And they use a group called the Australian Physiotherapy Council to do our regulation. In the World Physiotherapy, they have set up an accreditation process as well to enable countries where there's not a physiotherapy accreditation process to be able to accredit their physiotherapy programs. So what is accreditation? And I'm sure you're all familiar with it. It's recognition of physiotherapy professional entry education programs. And it's a process of engaging with the higher education institutes, reflecting and reviewing what's been done. Satisfactory outcome of the process relates in recognition of the programs. And that usually has to be then reviewed again at a different time. So accreditation, once you get accreditation, it's not a lifelong thing. It has to be reviewed and reviewed over time. And the last point there talks about who will do the accreditation. So if you're wanting an accreditation of a program, it is best to have someone review it externally. So a group of physiotherapists here in Australia, we have a number of physiotherapists. They can be academics and clinicians who will review the different educational programs and then give reports back. It's best if we can have accreditation done by physiotherapists. That's a really important thing because physiotherapists understand what it is, what is needed for physiotherapy, whereas some of the other health professionals or government officials don't really understand what it is to be a good physiotherapist. So a formal quality assurance process evaluated by an independent authority, it may be government or non-government and may have a statutory or regulatory function. As I say in Australia, it has a regulatory function. So the programs that are accredited, the physiotherapy programs that are accredited in Australia, the graduates of those programs automatically get registration. And as it says here, the reviews set against standards of practice. So the independent peer review is really important because we can see by getting together with people from different universities and with different ways of thinking, we keep the standards high. Sometimes when we just review ourselves, we keep repeating what we've done before because we haven't really looked outside to see if we could see things differently. And that's where leadership, of course, comes in. And I know now in Indonesia, one of the things that is really good is that you have an educators group. And through something like the educators group is where you can discuss what's changing in physiotherapy, what's needed to be changed in the educational programs so that we keep up to date with what's happening in the research, etc. So I think that that's a really important area. So as I say, it's a quality assurance mechanism, the accreditation. It considers how the components of the program are delivered and how it relates to the standards or the benchmarks that are expected. The accreditation process should be developed by the physiotherapy profession. And you can certainly take advice, obviously, from other bodies, because I'm sure your medical profession has an accreditation program, and I'm sure many other university programs have accreditation programs. But when it comes down to the actual accreditation process, that should be developed by the physiotherapists in conjunction with the Indonesian Physiotherapy Association and with your regulatory authority. So it is, as I say, an important thing to make sure that physiotherapists are there. If it's off in many countries, as I say, it's part of a regulatory authority. And in some countries where there's no regulatory authority, then the professional association might be the one that gives the qualification or the program accreditation. So in India, as an example, they don't have a national regulatory body for physio just yet. It's about to come in, I think. But the Indian Physio Association is the one that then accredits the programs at the universities. So it's a really important thing to see that it can be done even if there isn't a regulatory body. So the process, and this is from World Physiotherapy, is that it's the education provider, so your university and the School of Physiotherapy, it's your responsibility to demonstrate that your program meets the accreditation standards. You have to be able to prove it, if you like. It's a bit like doing an exam. The students have to show to you that they've learned what's been presented to them. So this is a similar sort of thing. You've got to demonstrate to the accreditation people that your program has met the standards. The accreditation standards should be outcomes focused. So saying what you expect from the program to produce, so that students, if they read it, would know what to expect by the end of their program too. And so you'd expect to provide program structures, curricula, how the education is delivered. We also, I think accreditation also acknowledges, and it does in Australia, it shouldn't be so set that it doesn't recognise that universities are different and that different universities will approach things differently. So if I go back to India again as an example, up until recently, and I know it's changing, they have set, you must do this subject, you must do these number of hours. In Australia and in a number of other countries, the proof has to come from the education provider that you have achieved the standard, but you're not dictated to as to what you have to do. I hope that makes sense to you, because if I give an example, we have some universities here that are specifically in some of our big rural cities. And they were set up there so that students graduating from there might practice in the rural areas rather than in the big cities. Their program is often a bit different to that at, say, the university I'm at, the University of Melbourne, which is a research-intensive university. So we have different outcomes that we might expect from our students, but they still all have to reach the same standards. So we're not told that you have to have 100 hours of clinical practice in the undergrad program. However, generally it seems that round about 100 hours is appropriate to get the competencies required. But it then again depends whether you're using a lot of simulation or you're using a lot of case-based learning or what you're learning, you mightn't need quite as many hours. So the curriculum itself is flexible depending on the fact that you can reach the outcomes that are needed. And the accreditation process too needs to be a very positive process. Sometimes I think the universities feel as if the accreditation people are, you know, looking for every little piece that they can criticize them on. But really the accreditation process is a collaborative professional process where people meet together and reflect and discuss that standards are met and that quality improvement is occurring from the peer assessors, if you like. So the standards, the organisation, so the higher education institution, the accrediting body will review the entry level programs, establish and apply standards that ensure quality, articulate the criteria region, so it should be clear to the university what is needed, describe the process and timing of the review, so you know when you have to put in the documentation, when it'll be done, etc. And also then provide back to the higher education institute reports about the process and what happened. You need to be looking at program content. So that is really what we teach, what the curriculum is, if you like. So what subjects are taught, what's taught in the subjects, how it's taught, how it's examined, all those sorts of things. Resources available to the program, so are there lecture theatres, are there laboratories for pracs, what's available, what's sorts of libraries available, are there things for student support, etc., etc. A mission and philosophy, so a philosophy about your teaching and the educational background to it, and details of the academic faculty, and also things like scholarship for students, etc. So a statement of philosophy, principles, values, a statement, so what we would call graduate outcomes. What do you expect your graduates to come out like? Will they be lifelong learners? Will they be able to work across different areas of practice? Will they be able to work in the city or in rural areas? What are the student outcomes? What are the graduate outcomes? So we expect that you will state what your graduate outcomes, that they will be able to practice evidence-based practice ethically and legally. So those broad pictures of graduate outcomes. A description of the curriculum model, as I said before. So what's the philosophy behind it? Where's the evidence for your curriculum? The same as we need to use evidence for practice, we need to use evidence for our curriculum, for our teaching and learning, because it's exactly the same. We need to make sure we're not just teaching as we did 20, 30 years ago, that we're using the latest educational evidence to build the curriculum. So a description of the course modules, when it's taught, how it's taught, how that teaching will facilitate their learning outcomes. So we need to always keep coming back to those learning outcomes. We've got program learning outcomes, but each of the subjects will have subject learning outcomes. So if we took musculoskeletal physiotherapy, a learning outcome might be that the students are able to perform appropriate mobilization techniques. So what's the teaching strategy we're going to use for that? Well, we will use a practical class. We might use some videotapes to show them how to apply mobilizing techniques. And then we need to follow it up with the assessment. How will we assess the students so they know if they've achieved the level and the standard of the learning outcome that's expected? So they're the way we go about, if you like, that sort of curriculum plan. Using a variety of different teaching methods. You know, we've learnt through the COVID time that we've got to be pretty smart. We've also all had to go with online learning and breakout rooms for tutorials, but we can use problem-based learning, we can use inquiry-based learning, we can use simulation, we can use lectures, we can use practical classes. So looking to see what is the most appropriate way to be teaching the different parts of things. And again, a variety of assessment or evaluation processes. How do we know, and how will the students know if they've achieved it? So getting away from using a standardized exam, a 3-hour exam at the end of a subject or something, looking at some feedback exams during the semester, quizzes, student presentations, trying to use a variety of different assessment tools that reflect the learning outcomes. And particularly the last point here, describing what happens in the program with clinical education and how you might assess clinical education and give feedback from the supervisors, how you train the supervisors, what you expect of the supervisors. You need to provide evidence of documentation of ongoing evaluation of your program, and that's what you're doing today, so that's really good. You're doing a curriculum review, and so systems reviews are really important. And when you're doing those, obviously getting data from a lot of people, so from your staff, from your clinical staff, from students, and from employers of your graduates. What do they think of the graduates who came from your school? And so then obviously you do a strengths and weaknesses of the program. What do we need to do better? What can we do differently that will help us get past the some of the things that were decided were weaknesses? And determine whether you have the practice expectations and specific programmer and expected student outcomes. So these are what you need to be doing in your accreditation documentation. Ensure the provider of the program is with an appropriate higher education academy. So you're with an academy that I'm sure has is registered by the higher education, through the higher education department in Indonesia. But we'll see in some countries, some private universities set up, they don't get approved by higher education. So it's a really important one to make sure that you're enrolled with the higher education and that you've got approval by them. Demonstrate that there's sufficient financial and administrative support, and this is often a problem. A program starts off and everyone's very enthusiastic, gives you lots of money to start off with, and then a few years later it's like, oh, you know, you'll have to have less staff, less this, less that. So you have to demonstrate that the university still provides sufficient finances. And that there are policies, proper policies in place around faculty appointments, their roles, what expectations, etc. Policies and procedures generally. So the rights and responsibilities and safety of faculty and staff, students, the patients we work with the undergraduate students. Student admission, so that it's clear how students are chosen to come into the program. retention. So if you started off with 50 students in first year, how many students do you have in second year? How many in third year? How many in fourth year? Because that tells us a bit about the program, whether it's being successful or if the assessment processes are successful, or even if the selection of students is successful. So if you started off with 50 students in first year and you ended up with only 20 students in second year, something would have gone wrong in your admissions perhaps, and also the way you assess. Policies regarding clinical facilities. So you need to have perhaps contracts with your clinical people so that safety is ensured in the hospital facilities, and that we can make sure that both students and staff are safe and the patients are safe in the hospitals. So really important having policies and agreements with our clinical people. And the standards of expected behaviour for students, so the students know what's expected of them. Teaching facilities, and you were just talking about that before, Ali, when we were talking about classroom and laboratory space and the equipment that goes into them, that make sure that we can teach the program that we want to teach. Good access to internet, search engines, books, etc. And things such as student housing, student counselling, student health, all those sorts of facilities for students. Then your clinical facilities, a variety of facilities from tertiary to community centres, urban and rural, across the lifespan, making sure that we're looking at paediatrics as well as going right through to palliative care at the end of life. Making sure that clinicians are appropriately qualified. So how do we as a higher education institution put in programs to help our clinicians, if you like, to become educators in the clinical site? And having good liaison or good relationships between academic and clinical coordinators, so that you're constantly talking and someone is appointed to talk with the clinicians about the teaching processes. So if I look at that from that and take you through a bit of the Australian one, because it's what I'm most familiar with, and it coincides very closely with World Physiotherapy, as we've just been talking about. So as I said before, we have the regulatory body, the Australian Health Practitioner Regulatory Authority. It's much easier just to call them AHPRA. It's a big, long word, title otherwise. They do registration, which includes the standards of practice, the code of conduct, mandatory reporting, and we have to have indemnity insurance. Then they also do, and they give this out to the accreditation of Australian education programs for Australian programs, but also accrediting physios from overseas who might want to work in Australia. And they developed the threshold statements. So that is the Australian Physiotherapy Council. So AHPRA accredits, as I said, all schools of physiotherapy in Australia, overseas graduates. And if I've been out of work for 4 or 5 years, I've had 3 children and decided not to work for it, I have to do some retraining, if you like, to get my license back to be able to work again. These, as I said, were the thresholds, the Australian New Zealand thresholds of practice, which is not only for the new graduates, but for all of us, and that is designated through the regulatory authority. So when we're looking at our accreditation process, we look at these 5 domains: public safety and academic governance, program of study, the student experience, and about assessment. Is assessment fair and equitable, etc.? So I'm just going to show you a few examples of those domains to show this is what the School of Physiotherapy has to show evidence for when they're doing their accreditation. So public safety. How do you, the criteria is protection of the public and care of patients is prominent amongst the guiding principles, etc., etc. You have to give evidence, and the accreditation, the Australian Physio Council gives some sort of guidance to the sorts of things that you might include to show and demonstrate that you are making sure that the public is safe. So first of all, your statement of your learning, your educational philosophy, learning outcomes program, a site visit. So there'll be a site visit, a meeting with academic and clinical education people. But the statements about the public safety would be something like, do the students have to have vaccinations before they go into clinics, because that's protecting the public, if you like? Do you have a contract with the clinic so that they teach the students about the health and safety precautions and risk management when they're in the clinic? So these are the things that protect the public, if you like. Students are supervised by suitably qualified physiotherapy and health practitioners. So your policies that you have about what level the clinical educators have to be when they're supervising your students. The criteria 1.5 provide clinical placements that have robust quality assurance policies and processes. So we need to have a look at the clinical placement agreements, their policies, and you could visit them. The students and staff are held to a high level of professional and ethical conduct. So what are the policies and procedures both for students and for staff? And what happens if a member of staff breaches that, or a student breaches it? Because these are issues to do with public safety, if you like. The second criteria that we have to assess against is the academic governance. So looking to see what the structure of the higher education institution is. How is it governed, and where does the School of Physiotherapy fit into that governance process? And do they, the higher education institution, as well as the School of Physiotherapy, do systematic monitoring? So looking at the how you do the monitoring and the reviews, as we talked about with the World Physio ones. The program of study. So what have you based your educational program on? Have you used the latest educational research about the best way? And there's a lot of different ways of looking at education, but have you looked at how we use constructivist philosophy, where we construct the curriculum to align the assessment with the learning outcomes and with the teaching process? Things like that. The program should have physiotherapy, and you'd show a map of the program, timetables, so that the accrediting body can see that the students aren't overloaded, that it's logical, it follows a logical process in when you're doing the teaching, so that you don't teach the most complex things in first year and you might teach them in the third or fourth year, and that the curriculum mapping does that alignment, if you like, of the learning outcomes to the assessment processes. Domain 3, program of study. So what does it include? Well, it needs to include research competency. So how do they go about learning about research? But not only how do they go about it, but how do you assess their learning in research? Do the staff use appropriate learning and teaching methods? So are they using up-to-date methods, using a variety of methods that suit the topic that's being taught? Your staff are appropriately qualified and they cover all the areas. So you've got someone who can teach pediatrics and someone who can teach geriatrics and someone who can teach physiology. You need to have all areas covered. evidence of interprofessional learning and practice. So we need to demonstrate that we have interprofessional learning core to the program and that it is assessed too. And how is it assessed? Cultural competence, and that's a very strong one, and I'm sure it would be in Indonesia as well. And here, because of our Indigenous population, it's a very important area for our graduates to be able to understand our Indigenous populations and to be able to work with them. But also we're a very multicultural country, and we have to make sure that we're competent to work with people from many different backgrounds. And again, we need to demonstrate how we assess it. So it's no good just saying there are learning outcomes. We have to show how it's assessed. We need to demonstrate the facilities and the equipment, and we need to show evidence, a certificate that we're complying with the National Higher Education Standards. So in Australia, we have standards that are set for bachelor's levels, master's levels, as I'm sure you do in Indonesia, and we have to show that we're complying with those. And Domain 4 is the student experience. So a really important part of it. Do they have all the important information, how they can get into the program? What are the prerequisites to get in? What's the admission process? How do they move from 1 year that they have to pass all subjects to move into the next year? How are they supported during the program? How will they be able to talk to the academic staff? Getting students involved in committees so they can give feedback, make sure they've got the policies and procedures that are appropriate, to making sure that the students know their rights and their obligations, know what's there for them. So libraries, how they can get to the libraries, what happens with financial support, etc. And Domain 5 is around assessment. Assessment policies. So what are your policies about it? Do the students have to pass every subject? What's the pass mark? So students know that. How do you go about it? So is this made very clear to the students and to everybody else, the linkage, if you like, of the assessment policies and procedures? How students can appeal against it, how quickly you've got to get assessment things back to the students. Linkage of program and subject learning outcomes, and I've said that a few times. You've got to link both the subject learning outcomes to the program learning outcomes, and then the assessment of each of the subjects with their learning outcomes. What assessment are you going to use? How much, how often, how do you give the feedback? What sorts of things are you going to do? So it's often a good idea to make a map of the assessment for the program. So the accrediting committee can then see when assessment takes place. Is there too much at one time, not enough at another time? And are the right staff doing the assessments? So they're the domains under which the schools of physiotherapy in Australia are accredited. So just looking at the process to finish off a little bit with this, the process of accreditation, as I said, is set out by, and the standards by APRA, by the regulatory authority, and it's a protected one through the National Board. The accreditation level programs must reach all of the attributes and competencies defined in the physiotherapy practice thresholds. And they were the things we talked about before: the educator, the communicator, the practitioner. They have to reach all of those, because as well as the attributes, under each of those are the competencies are defined. And then for the initial program, so if I was at a university that wanted to start a program of physiotherapy, I have to let the accreditation body know 2 years before we start. So it's a 2-year dialogue to get the program up and started. So 2 years before you start, you would talk to the Australian Physiotherapy Council and say, we're interested in starting a program of physiotherapy. So from there, and it's a bit small, but I hope you can read that, they apply for that and they get the documentation that will tell them about the sorts of things and why they're going to start and how they'll manage it. And then within 6 months of that first application, they have to put in a report of where they're at, how many staff they've hired, what facilities they've got set up, how's the education program, have they got clinical sites organised. And that report will be reviewed by an accreditation committee, and the report's given back to the provider with suggestions and ideas how it might change. Before the program can start, 9 months before the program starts, the panel, the accreditation panel, does a visit to the university, a site visit. And that site visit will include talking with the higher education people like the deans. They might even talk to the vice chancellor. It'll talk about finances. It'll talk about all those sorts of things within the original documentation. They'll also look at the university's equipment, the rooms, the facilities, etc. And they will also ask to do a site visit out to some of the clinical sites that you might use. Again, a report is sent back to, from the committee is sent to the education provider, who can read it and comment if there's any things that they don't think are right. And then the recommendation has to go to the regulatory authority to get approval. And the decision will come to them 2 months before start. It's a final decision about anything that had to have been changed and things. So you can see it's a long process. It's a 2-year process for them to go through on those timelines. Reply, site visits at 7 months, approval, any amendments. And for those who are accredited, so if I take the University of Melbourne, where I am at, it has an accredited program, but every year we have to put in an annual report. We have to put in things such as enrolment data, evidence of our clinical education placements, any changes to academic staff, or identification of any major changes to the program. It might include funding changes, things like that. And the outcome from the annual report can be, it stays the same, it's accredited with conditions, or the accreditation is revoked. But your accreditation, when you receive accreditation, usually lasts for 5 years. And in between times, you have to put in the annual report. So, key to changing practice is education, and the key to ensuring excellence is through our processes that we do and through accreditation. And accreditation is that done by physiotherapists. So these are the references that I've used from this, and they're really good references for you to use while you're doing a review, and particularly if you're going to be looking for accreditation with World Physio, or even through the Australian Physio Council. They will accredit international programs as well, if you want to look at that as well. So it's, you know, there's a lot of information out there, but accreditation takes a lot of time as well, as I'm sure you're all aware. So I haven't got anything more that I want to say at the moment, but I'm very happy to enter into a discussion or answer any questions that you might have. And I hope that that was a useful presentation for you. And I'll stop sharing the screen and we can get back together again, okay?
Okay, Prof.
Good.
So, okay, so that's the materials that have been spoken by Professor Gillian Webb. So we are come into discussion session. There are some questions that already in our discussion.
Mm-hmm.
So maybe you can answer it, direct answer after if each question that I've explained to you, Prof.
Yep.
Okay, so for the first question, in the curriculum of physiotherapy, what do you think we need to improve more? Which one has the biggest percentage in accreditation? Like we need to more focus on knowledge or more in practice for undergraduate students?
Mm-hmm. It's always hard, isn't it, to mix how much time through, if you like, basic knowledge and how much through clinical practice. I don't think we can be too definitive of that. The problem we have is there's always new things that we want to put into a curriculum. And as physiotherapy practice changes, how do we manage to keep up the practical side of our profession and our clinical side, and also make sure we keep up with the new evidence for our practice? So I think that I think in Indonesia you've gone to a way where you have a residency or an internship afterwards, which is still a learning process as well. However, during your program, it's really important to have that clinical practice. And if clinical practice is hard to be doing, we can do a lot more by using problem-based learning, using simulated patients, and that doesn't have to be high-tech simulation. It can be actors, it can be patients coming in and having demonstrations and practice. We can look at different ways of presenting our clinical side of things so that the students get confident in the way they interact with people prior to going to the clinic, so that when they go to the clinics, they're well prepared to be able to start doing the more difficult work, if you like, of the interactions with the patients. So I think it's hard to, you can't say, look, 50% should be theory and 50% should be practice. I think we need to do a lot more of our theoretical work needs to be around discussion and debate and things, rather than sitting through a lot of lectures, because we can put the lectures online and then we can discuss the more difficult points in a seminar or in a small group learning. I think the important thing for us to understand is that it's our responsibility to ensure that the clinicians have been trained as educators. Unless your staff goes out, we have to train the clinical educators, because the time, including, I think, in their internships, well, particularly is it 18 months your internship?
No.
How long is your internship?
Actually, for internship, we have like a special program for the undergraduate students. It's about 1.5 year, 1.5 year.
1.5 years, yes. And that still is a teaching time. So I think people have to recognize that internship is still a teaching time. But I'm hoping that in your earlier years, that you include some clinical exposure as well. So when you used to have diploma programs and the Diploma 4, they included their clinics within their 4 years. I'm hoping that in your bachelor's programs, you still include some clinical time during the bachelor's and don't leave it all to the internship. Because students, when they get into the real world, if you like, of clinics, understand much more why they needed to know the anatomy or why they needed to know the physiology or the biomechanics. So I don't know if that's answered the question, because I don't think it depends so much on your curriculum. I can't say to you, you must have this number of hours in theory, this number of hours in clinic. You've got to have the number that will enable you to reach the standards.
Okay. Thank you, Prof. Actually, we have, before we have like a clinical exposure for some students in every year, starting in their third year and fourth year, in every semester or every term. But
Yeah,
because of pandemic, yeah, it can be applied, so the students cannot get into the practice field.
Yeah, no, that's terrific, because I think that then makes the students realise why they've learnt anatomy, and that learning anatomy in first year, you've still got to remember it when you're in the clinics, and because it's forever learning your anatomy. Yeah.
Yeah. In line with your explanation, there is a question in the chat box: how to improve students' experience during a pandemic? Several ways, such as giving learning videos and giving explanation, giving quizzes during a pandemic have been carried out, but it's not that easy to give the students understand with our intention how to improve students' experience in this pandemic condition.
During the pandemic.
Yeah, like you said, we have already give some like several options to students to learning, like videos, quizzes, explanation, theory, but sometimes it's still hard for students
I think it's been very, very hard, hasn't it? So I think videos and things like that is really good, and they can practice with their family perhaps some of the skills and things, but also making sure that they can get together in small groups to discuss things, perhaps without even a tutor there, or a facilitator can be like a case-based learning, so they can go into a breakout room or something and use a case-based learning, so they're talking with each other. Because I think the thing they miss a lot is that they're not getting together with each other and sharing ideas. So I think the more you can do some problem-based learning, case-based learning, getting them to go into a breakout room, but then bringing back their ideas to the larger group afterwards, so that they feel more engaged in the with their colleagues, and they feel more engaged in the process of learning, rather than just listening to a lecture or listening to more lectures or listening to more lectures. The more interactive we can make it, and the between students. And we've got to remember that students are smart. We don't have to be telling them things all the time. They can look up things as easily and probably better than I can. That we should be encouraging them to use that small group learning, particularly during the pandemic, I think, so that, and we acknowledge their learning as they bring it back to us, and then the discussion can be with the whole group about differences that they might have come up with the same case or something, and then where there are difficult concepts, that's when the academic can perhaps bring in a bit more of an explanation around the difficult concepts. Yeah, but it's not been an easy time at all, this pandemic, for anybody. I think it's really very difficult. Yeah.
Yeah. Thank you, Prof, for your explanation.
Yeah.
Moving to the next question, for the participant, if you want to join direct question or giving a question to Professor Wade, you can join with raising hand first, or just unmute your audio and give a direct question to Professor Wade. Moving on for the next question. If we want to prepare accreditation as in international standard, this question from our lecturer, is there any requirement about on how many diploma level we need to have, like how many people with postgraduate level or doctorate level? If we want to fully the competency of international standard.
So what sort of levels and things? Well, that's going to vary, obviously, with the number of students you might have, the levels that you have. We have at the University of Melbourne, we would have people who would be lecturers, which are people who have done a bachelor's degree, been practicing for a few years, but they haven't necessarily done anything further. they might have done a master's program, and then our associate professors and our professors would all have PhDs. At a university, that's an expectation. All of our staff have to do a university teaching certificate, no matter what level they're at. So they all have to do a central university teaching certificate. And the numbers, so for teaching things like prep classes and things, we're more likely to use lecturer level because they're often working as clinicians at the same time. So if you're doing practical classes, you'll have clinicians who have been out and are teaching, have done a teaching process. The other side, of course, is the research side of things. So all the staff are expected to undertake research. And certainly the professors and the associate professors and even the senior lecturers would all be expected to do research, and the lecturers would be expected to be beginning to join in with other members of staff to do research and then go on to do their master's or PhD. Yeah, but so depending on the size of your group, so if you've got, say, 50 students and you've got 3 prac classes, well, you might want to have a senior lecturer and a tutor together running a prac class, so that you've got someone with a bit more theoretical knowledge and someone with more practical knowledge, if you like. So it just varies a little bit on the numbers of people, but the qualifications will depend a lot on the individual university as well. And because my university is a very high-level research-intensive university, research is very important. Some of the other universities, it's much more important around the education side of things. My PhD is in education because that's my interest. So the numbers and levels, I think, will be dictated more by the university, but it's always good having clinicians teaching some prac classes as well, because they're doing that every day. Yeah. But the clinical educators, it's really important that we educate the clinical educators so that they know how to give feedback, they know how to do assessment properly, they know about teaching theory, if you like, how to encourage students to speak up and to ask questions and things like that. Yep.
Okay, lovely, Prof. Actually, we have some active clinicians too in our program, so I think that's helped a lot for the senior lecturer to give based on the clinical practice one and the theoretical one. Okay, thank you, Prof. Moving on for the next question. Is that okay, Prof? I giving a question again?
No, that's okay.
Okay. In this pandemic, meeting the standard of educational standard in physiotherapy practice is difficult. How we solve this kind of problems and how we assess the soft skill of our students in this time of pandemic in order to achieve their competencies.
Yeah, so this pandemic has been a real problem, and I know our regulatory authority has had to look at this for the graduates, because obviously their education has been quite disrupted being at home. So there are quite a few people have taken to assessing students producing videos of techniques and things that they've practiced or whatever it might be. But the assessment process is really quite complex, I think. I think your rector said that students can come into the university for practical classes, and I would have thought for practical exams you would probably have to have that. But students are much, can use technology better than a lot of the older academics, if you like. And so I think we need to sit down with the students and think about ways they can show or demonstrate to us their learning at home. So it might be through a case-based learning process. Let's say you have a case that's a musculoskeletal, it's easy. Get the students to talk through the case a bit with you and then get them to demonstrate an exercise they might give, or to talk through how they might go about and set up a mobilization technique. And if they've got a brother or a sister or someone at home, that they could demonstrate that to them, something like that. I think we can use the case-based learning methods as a way of assessing by video and things. Students making a video of themselves doing something and sending it in and being marked against criteria that they've been given. As long as you give them the criteria, I think you can manage it. But I do know that quite a few of the schools here have had to postpone some of their exams till they can get out of lockdown and be able to do them and have access to come into the university to do some upgrading and updating of their techniques and things before they can do the exams. So I think it's just trying to be as creative as you can to see how you can manage this during this pandemic, because it is a very complex time for it. It's easy around the theoretical sides in many ways, even if it's boring listening to talk after talk. We can do that, but I think the practical side is quite problematic, yeah. What I can do is ask some of my colleagues in at the university what they did last year when they were in a total lockdown, and see if they've got some other ideas, and I can send them to your dean, to Ali.
Okay, thank you so much, Pro. Pleasure to hear that. Is there anyone want to join us in the discussion? Okay, Mr. Ali Imran, please, you can unmute your audio.
Okay, thank you, Devin. Prof. Gillian, pandemic is, I think, is a very difficult situation for us to improve comprehension for the student, but I think we need some strategies to solve this problem. Is it any new subjects that we have to put in our curriculum, especially for facing the pandemic? So we can set up the curriculum, and then our student can work in the pandemic situation. Yeah. Thank you.
Yeah. So I think there's quite a bit of information on World Physiotherapy around strategies for the pandemic and for teaching in the pandemic and for working in the pandemic. So I would suggest that you look at those, that's for certain. I will find out from my colleagues here at the university, but also from our regulatory authority, about anything that they have added in because of the COVID or because of the pandemic. I think what it says to us too is that we need to, in our everyday, regardless of when we've got a pandemic, we've got to teach our students about being ready for things like a pandemic. So here in Australia, I think we realised that perhaps our focus, we weren't strong enough on public health. So health promotion type activities and things. And I think that that's something as physios we need to be thinking about in the longer term. It's not a solution for right now, but for the longer term, about how do we as physios deal with emergency situations, if you like, pandemics, tsunamis, bushfires. How do we as physios, what's our role and how do we work in those? And I think that's a really important thing for us all to be looking at under a public health, if you like, health promotion strategy type thing to be thinking of. I know in some parts of the United States, where they have a lot of very bad tornadoes, they take away their all their health professional students in an interprofessional camp and simulate a tornado, what the students have to do at that time, how they would work in it, and etc., preparing them for emergencies, if you like. So I would think that, I don't know if you have any simulation laboratories available to you for teaching how to manage patients who have got COVID or who are in intensive care. They're the sorts of things from the clinical side of things. I think the long-term rehabilitation, because it sounds as if people will have long-term issues from this COVID-19, I think they're things that we're all going to have to find out about. I don't think we quite know much about it yet, but obviously in rehabilitation, we have to assess those patients and look at their long-term outcomes. And I think chronic fatigue is going to be one of the issues coming out of it.
Yeah.
So I'll certainly follow up some of those and send you any links or anything that I can for you about what people have done during, and what the regulatory people have done about some of the students having missed clinics or delaying clinics, or how that's all happened with those things, and see what the different people have done here around the teaching. I know that there's been increased use around the sort of simulation labs and simulated patients. So, you know, being able to get someone in and a member of staff simulates, if you like, what's going on, and you can videotape that out to your students so they can at least get some ideas from that as well. But it's a difficult time for a practical course like physiotherapy. Yeah.
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 Okay. Because in our experience, we are still send the student to clinical attachment in the hospital and also in the clinic with head protocol, I think, because you know that all physiotherapy competention is based on hand-on activities. Yeah. So I think the video, the model is never same with the real situation in the practice. Yeah. And you know that today, especially in Indonesia, all health professional is very busy, and some of these infected, and hospital need a new student, new graduate to replace them. And if they don't have, if the new student, the new graduates never know how to work in the pandemic situation, I think it will be the quality of services will be decreased. Yeah. Yeah, I think we need brief to send the student to the clinical situation in the pandemic.
Yeah, well,
what do you think?
If you can send them and they can be safe. I know last year when we had a long lockdown, our students couldn't go for quite a while to the clinics. They weren't allowed to go when there were a lot of patients. Then towards the end of the year, the students were allowed back into clinics. But of course, it was again fairly limited where they were allowed to practice. I can only think that perhaps if your students are allowed in the clinics, that your academic staff perhaps should be helping the clinicians in the clinical arena. So going out to the clinics with the students and perhaps running it as small group learning almost round the patient. I don't know how else you can manage that, but I will try and find out here what happened with the staffing. But I do know that it did delay everybody and delayed graduation for quite a few students as well. Yeah.
So what the Melbourne experience, Prof, in this situation?
Yeah, so that's, I'll have to find out what they did. I'm not certain what they did. I think that when the students went back into the clinics, they were able to do certain patients and not other patients. They weren't allowed. They weren't allowed to go near. Early on, they weren't allowed to go near the COVID wards, let's say, so they could treat in the other wards and things, but not in the COVID wards. And then, of course, a lot of the COVID in the intensive care has been done by physiotherapists, and so the training around positioning of patients and all the respiratory thing, I think we can do more of that. Do you have access to a simulation lab at all?
Yeah, we have. We have it.
So I think a lot of what we need to do for intensive care and things has to be done through simulation labs and things for the time being. How you position a patient, how you sit them up because of their breathing, their problems with the respiratory problems. It's mostly the respiratory problems when they're intensive care, but also beginning to get them to exercise a bit. It's probably no different to what you'd normally do in intensive care in some ways. And it amused me that we had always positioned and posturally drained our patients. And now the word they use in Australia is proning. So the patients were put on their stomachs because that allowed the fluids in the lung to move out more easily. Now, as physios, we've known that for a long time. And it just, they gave it, instead of calling it positions and things, they called it proning. So we've got to change our language, I suppose, to deal with that. So we're not just dealing with the right upper lobe or the left upper lobe or postural drainage. Now with the COVID, it is trying to get the whole lung to be able to move fluids and get a better respiratory rate going, and they learn to prone the patient. So the students have to learn how to put a patient in an intensive care situation onto their stomach.
Okay, thank you, Prof. The next question is, as mentioned by Bapak Vice Rector, that the physical therapy department will move to the international accreditation. And thank you for explanation about the five domain in the Australian accreditation. So do you suggest us to move to Australian accreditation for us, or other body in the world?
I think there's well, I mean, World Physio will do accreditations. And I know that the Australian Physio Council will also do accreditations. If you are interested in the Australian one, I can put you directly in touch with the gentleman who's in charge of that, and you can talk through with him about the accreditation process, what it costs, all those sorts of things. WCPT or World Physio, it would be worth talking to Trudy, Tracy at least. You know Tracy, don't you? Who works in
Tracy?
Yeah, Tracy Berry.
Tracy Berry?
Yeah, I think she's responsible for the accreditation sort of processes. And again, finding from her how long it takes, how much it costs, etc. Either one of them would be a very good program. So if your graduates had Australian accreditation, they would then be able to work very easily in Australia, and I would think quite a few other countries as well. So there is that. I presume the same holds if they have accreditation from World Physio. I'm not sure about that. Mostly countries who have done accreditation through World Physio have been where they don't have a strong accreditation process in their own countries, or they don't have a regulatory authority. Yeah.
Okay.
So it'll be a balance, I think.
Okay. If we decide to move to the international accreditation, could you be our supervisor to start this process?
I'd be very happy to help you read your documents, develop your documents and things like that if you'd like me to do that. Yeah. Be very happy to do that with you.
Yeah, that is the point.
Yep, I'd be very happy, Ali.
Oke, Bu Dika. Jadi supervisornya sudah ada tuh, Bu.
Yeah, no, I'd be very happy to help you with any documentation, whether it was World Physio or whether it was the Australian accreditation. I could help you with either of those. Yeah.
Okay. Thank you, bro.
Yeah, not a problem. I knew you'd ask me to do something. That's all right. Are there any more questions?
Thank you, Mr. Ali Imran. There are some questions. Some of the staff told me that you have appointment after this. Is it okay if we give like a two question more?
Yeah, I'll have to finish by 1 o'clock here, so about 10 minutes more.
Okay, so one question again is, what do you think about the predominance in physiotherapy department? So we have in Universitas Asia Yogyakarta, in our physiotherapy department, we try to give more impact in one field. It is musculoskeletal orthopedic. So we want that field to be our, what is it, like our advantage or our if you have any suggestion, how we prepare for this? Do we need more like what is it, like lecturer or more clinical place for practice that more focus on musculoskeletal program or what?
So because we're talking accreditation, you have to make sure students have similar experiences across all of physio, not just musculo, cardio, neuro, pediatrics, geriatrics, etc. So if I was thinking about you wanting to do more in the way of musculoskeletal, I'd do that as a master's program. Because I think that it's very hard to, well, let me say, most programs, more of the program is about musculoskeletal anyway, because that's what we see in practice, I suppose. Cardio, and we know the evidence for cardio, although funnily with the pandemic, there's more evidence for physio practice, but a lot of the practice that we did in the past, we don't use these days. So we have to look at the evidence and see what it is that we need to be working on. So instead of saying we're going to do more musculoskeletal, what I would say is look at the components. You want to do more on pain management. Now, pain management is for all patients, whether they're neurological patients, patients postpartum, whatever they are. So pain would be a key program. Exercise and exercise physiology, designing exercise, that's for everybody. It doesn't matter whether they're neurological patients, cardiorespiratory, musculoskeletal, pediatric, geriatric like myself. Exercise is really, really important. So that's the way I would focus it, rather than, I think the program will always have, let's say you might have 2 practicals a week of musculo, 1 of cardio and 1 of neuro, although in Indonesia you might want to have 2 of neuro because of the neurological issues you have both pediatrically and with your older communities. So have a little think around what it is that you want when you think more musculoskeletal. If you're talking about pain management, that's for everybody. If you're talking about exercise, that's for everybody. And you can use exemplars that might be, half of the program might be muscular and the others for other parts or whatever, but you can make sure that you're covering off in a more generic way, which then biases towards those. So I'd be a little cautious, but as I say, most programs you would find probably the students would have a breakdown of something like perhaps 40% 40% musk, 40% neuro and 20% cardio. I don't know, but perhaps something like that. But don't forget the neurological, because it's such an important, and then of course you've got all the other bits and pieces like diabetes and in the cardiorespiratory, of course. In fact, I should be saying, when you're looking at that, as my suggestion about exercise, because we know that cardiac rehab and pulmonary rehab is all about exercise and nutrition. So they're really important issues. So think about it more about what are the skills needed, and I would come at, because in exercise you can do cardiac rehab, pulmonary rehab, neuro rehab, musculoskeletal rehab. You know, you can do rehab into the exercise as long as you've got the really good principles around it. Does that make sense?
Okay. Yeah, makes sense, but
you must have been talking,
difficult to apply.
Must have been talking to the private practitioners. They all want just musculoskeletal.
Okay, thank you, Prof. For the last question, in the current pandemic situation, should we lower the standard for student assessment or not?
What was that? Sorry?
In the current pandemic situation, should we lower the standard for student assessment or not?
I don't think you should lower the standard. I don't think we should ever lower the standard. We have to think about how we get to the standard. And I think that's the issue. Yeah. And I'll try and find out a bit more for others around about, but there's some good stuff on World Physio around that, and also on the AWP messenger site, where we've had lots of people put in things that they've done, videos, etc., etc. So I'll find out a bit more for you, but no, we should never, 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 never lower the assessments. Never.
Okay.
Never.
You can see that.
Very big note for us. Thank you, Prof.
Yeah. So, stay on the high standard.
Yeah.
Yes.
How we reach that? Yes, Prof. Okay.
Absolutely. You fought so hard to get to where you are. We don't want to lower it down. You have really fought so hard in Indonesia, and Ali particularly. Don't lower it down. We can't do that. But if you want to do more musculoskeletal, do a master's program. Yep. Yep.
Okay, thank you so much, Professor. I think well, there are still some questions, but because the limitation of the time,
you could send me the questions by email, and I can answer them for you.
Okay, so yes, ma'am, we will send the question to you, and maybe we have further question to you about our international curriculum. Thank you. Thank you so much for sparing your time, sharing your journey and experience. It's not my first time talking to you, yet it's always been delightful and a pleasure talking to you, because like there is so much learning every time I speak to you.
Well, it's always a great time for me. So thank you very, very much. Send me some documentation when you're thinking about it, and I'll send you some other information. And it's so, so lovely to see you all, I have to say. And you'll see my tears that I'm not in Indonesia, but hopefully sometime, hopefully next year, but we'll just have to wait and see. So goodbye, everybody.
Bye.
Thanks for being with us today.
Thank you. See you. Miss you.
Thank you very much.
Bye-bye.
Bye.
Okay, bye-bye.
Yeah.
Thank you, Prof.
Thank you.
Okay, thank you for the participant who has been active in our discussion. And this the lecture from Professor Gillian Roodweb. Thank you for sharing with us all of the participants. May all of us get the value and benefits from the workshop. Okay, finally, we come to the end of our event. From the deepest of my heart, I do apologize if I have any mistakes in presenting this event. Thank you very much for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh. Stay healthy and stay safe.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Bapak Ibu, Mbak Devin.
Ya, Bapak Ibu, mohon untuk stay dulu sebentar karena akan di-capture terlebih dahulu untuk dokumentasi. Baik, untuk slide pertama, mungkin yang ingin menyalakan videonya sebelum kita mulai. Baik, saya hitung dari slide pertama 1, 2, 3. Untuk slide kedua 1, 2, 3. Oke, dan untuk slide terakhir 1, 2, 3. Terima kasih. Semoga sehat selalu semuanya.